Have you ever felt that sharp, stabbing pain in your ears when the plane is landing? The kind that makes you just grab the armrest and count the seconds until touchdown? Now imagine that same pressure change, not just in your ears, but in your lungs, your heart, your brain, or around a recent surgery. If you're over 70, or you have parents or grandparents who still love to travel, there are warning signs your body gives you that you should never ignore before flying. You're watching Fast Track Flyer. We break down what really happens to your body when you fly, so you can travel safer and smarter, especially as you get older. Quick disclaimer before we start. This video is for education and awareness only. It is not medical advice, and it does not replace a visit to your own doctor. If any of this sounds like you, or like someone you love, please talk to a healthcare professional before you fly. When the aircraft doors close, the cabin is pressurized, but not to sea level. Inside the cabin, your body is suddenly in an environment similar to a high mountain. The available oxygen drops, the gas inside your body expands, and your heart and lungs have to work a bit harder to keep up. For healthy travelers, that usually means some ear popping, mild fatigue, and maybe feeling a little sleepy. But if you already have health problems, this change can be the tipping point. Sign number 1, severe ear or sinus problems. Let's start with something almost everyone knows: ear pain. If you already have a bad ear infection, a serious sinus infection, or you're completely blocked from congestion before you even reach the airport, flying can be much more than a bit uncomfortable. During takeoff and especially during landing, the pressure around you changes quickly. Normally, your ears equalize that pressure through a tiny canal called the eustachian tube. But when that tube is blocked, the pressure in your middle ear can't equalize. That's when you get intense ear pain, a feeling like your ear is going to burst, dizziness, and in more severe cases, even a small tear in the eardrum or a worsening of an existing infection. For older travelers with fragile hearing or past ear problems, this can be extremely painful and slow to heal. If you have a diagnosed ear or sinus infection, or you are so congested you can't pop your ears on the ground, don't just rely on nasal spray and hope for the best. Ask your doctor or ENT specialist if you should delay your flight until the infection is cleared. Ear pain alone may not kill you, but it's a very clear signal that your body is struggling with pressure changes. And if your ears are already in trouble, imagine what happens when your lungs, your heart, or a recent surgery site are not ready either. Sign number 2, recent surgery or major dental work. This is one people often ignore because they feel fine. The issue is not just how you feel today, it's what's still healing inside your body. Some procedures involve air or gas trapped in certain spaces. Eye surgeries, especially retinal surgery with a gas bubble, laparoscopic or abdominal surgeries, some ear, sinus, or chest operations, and heavy dental work like root canals or deep fillings. In the cabin, gas expands as the pressure changes. A tiny gas bubble in your eye can expand and sharply increase the pressure, causing extreme pain and, in the worst cases, even permanent loss of vision. Gas left in your abdomen can stretch tissues, pull on stitches, and increase the risk of internal bleeding. A tiny air pocket under a filling can become a brutal toothache at altitude. If you've had any significant surgery or major dental work in the last couple of weeks, ask your surgeon or dentist explicitly, is it safe for me to fly in a pressurized cabin right now? If the answer isn't a clear yes, you wait. The flight can be changed. Your body only gets one chance to heal properly. Sign number 3, you're short of breath doing simple things. This is crucial if you have COPD or emphysema, pulmonary fibrosis, a recent pneumonia or severe bronchitis, or lungs that just haven't fully recovered after an infection. Here's a quick home test. Can you walk about 50 meters at a normal pace without stopping to catch your breath? Can you climb one flight of stairs without feeling completely wiped out? If the answer is no, your breathing is already struggling on the ground. In the air, your blood oxygen level usually drops a bit more. For healthy lungs, that's not a big problem. But if your oxygen is already borderline on the ground, the cabin environment can push you into dangerous territory. Confusion, blue lips, extreme fatigue, or even loss of consciousness. And no, the yellow oxygen masks that drop from the ceiling are not there to manage chronic breathing problems. They're designed for a sudden loss of cabin pressure, and they only work for a short emergency period. If your oxygen at rest is low or you're easily breathless, you should not fly without a clear plan made with your doctor, which may include in-flight oxygen or delaying the trip until you've recovered. Flying with compromised lungs is like running a race while breathing through a straw. It's not just uncomfortable, it can be dangerous. Sign number 4, unstable heart symptoms. Having a heart condition that is well controlled is not the problem. The danger comes when things are changing or unstable. New chest pain, chest discomfort happening more often, pain appearing with less effort than before, sudden shortness of breath when lying flat, or very recent changes to your heart medications. Add airport stress, heavy bags, rushing to the gate, and lower oxygen in the cabin, and you have the perfect storm for a heart event in the sky. Yes, most planes carry a defibrillator and crews are trained, but an aircraft is not a hospital. If you've had a recent heart attack, new or worsening chest symptoms, or your cardiologist is still adjusting your treatment, you should not decide alone to fly. You need a clear, fit to fly from your doctor first. Sign number 5, a recent head injury or bad fall. With age, the brain shrinks slightly inside the skull, making certain veins more vulnerable. A minor head bump that wouldn't be a big deal at 25 can cause a slow brain bleed at 75. In the air, lower oxygen and pressure changes can make symptoms worse. Strong headaches, dizziness, nausea, confusion, personality changes. If you've recently hit your head and you feel unusually dizzy, have a severe or persistent headache, feel confused, or your family says you're not yourself, the next stop should be a doctor, not an airport gate. Flying with a possible brain injury is a risk you do not want to take. Sign number 6, one leg swollen, hot, or painful. DVT risk. We often talk about preventing blood clots on planes. Move your legs, stretch, drink water. But what if a clot is already there before you even sit down? As we get older, our circulation slows, and the risk of deep vein thrombosis, or DVT, increases. The danger? If that clot breaks loose during your flight, it can travel to your lungs and cause a pulmonary embolism, which can be instantly life-threatening. Warning signs: one leg suddenly larger than the other, a warm, red, or tender area on the calf. Deep pain that feels like a cramp but doesn't go away. If you notice these symptoms, the answer is very simple. You do not get on that plane. You go to a hospital or clinic and get your leg checked, usually with an ultrasound, to rule out a clot. For those with recent hip or knee surgery or a history of blood clots, this is especially critical to discuss with a doctor before flying long haul. And there's one more thing people rarely think about: travel insurance. Many policies include clauses about traveling against medical advice. If your doctor said, "I don't recommend you fly right now," and you still board that plane, and then something happens, your insurance company may refuse to pay for emergency care abroad, hospitalization, or a medical evacuation back home. A flight diversion or an air ambulance can cost tens of thousands of dollars. Taking a risk with your health doesn't just gamble with your life, it can also gamble with your life savings. This video is not here to tell you to stop traveling forever. Most of the time, the answer isn't never fly, it's not yet. Wait a bit, get cleared first. The world and all those beautiful destinations will still be there in a few months. The goal is very simple. You should still be there too, healthy enough to enjoy them. If, while watching this, you thought, "That sounds a bit like me," or "That sounds like my mom, my dad, my grandparents," please take it seriously. Share this video with them. Sometimes people don't listen to their family, but they might listen to a calm explanation like this. If this helped you, like the video and subscribe to Fast Track Flyer for more content on flying safer, smarter, and better prepared, especially as you get older. This is Fast Track Flyer, and I hope to see you safely in the skies.